Okay. Yep.
All right, 5, 4, 3, 2, 1.
Hi, everybody. It's Dr. Michael Hirsch from the Worcester Division of Public Health, the medical director, here with another edition of Stay Connected with the Worcester Senior Center. Happy to be back in the month of October. Boy, the year seems to be flying by. So we'll talk a little bit about some of the health challenges that we're facing once again here in Central Mass and in the United States, and also a little bit about October and what it means to most people, and what a lot of the organizations around the world and the medical organizations around the world have tried to emphasize for this month. October, as you might hear from the derivation of the word octo is the Latin for 8. So in the old Roman calendar, this was the 8th month. But when they switched over to the modern calendar, it became the 10th month. But they kept the name, October. And it's always been a month associated with fall, right? And harvesting. We have our big Halloween celebration, the end of the month, which used to have a lot more implications when I think the world was a lot more aware of things like All Saints' Day, which is November 1. The eve before November 1 was celebrated as a time when ghosts and goblins and unsettled spirits would rise up and plague the world. And now, of course, we look at it as just a joyous kind of a celebration for kids to get dressed up in costumes. And many of you seniors are frequently the ones that are walking the kids around the neighborhoods with their trick-or-treat costumes. So that's always an important time for us in the public health world and the public safety world to be emphasizing being safe about the times that you go out, to make sure you're not going out so late that people aren't expecting trick-or-treaters anymore, and that you're staying in crosswalks and going on walkable paths where drivers will expect to kind of have to slow down, wearing reflective clothing if possible, if it is a very dark night or even an early twilight kind of a situation. Those are the times when drivers frequently run into trouble. But in general, things that you will undoubtedly hear on the news for Halloween is warnings about people putting razor blades in apples and all different kind of contamination of the trick-or-treat goods. It's a good idea in general to accept wrapped food. That's the best kind of food to accept. Accepting people's own baked goods or even fruit is a little riskier because it can be contaminated. But it's very, very rare that people have encountered these kind of tragic situations. It just makes good news stories. The old expression in journalism, if it bleeds, it leads. That's, well, of course, what people will cover around Halloween. They'll always ask me in the trauma center to talk about Halloween safety, and really the most important thing is just being a safe pedestrian and making drivers on that night aware that little kids might be darting in and out of the street, hopefully with the help of whoever's supervising them as they go. And I wouldn't advise little kids to go, obviously, on their own. We don't see that very much anymore. There's a lot more awareness of this. So October is that, kind of harvest month. And, the leaves turn, and right around Indigenous Peoples Day, which is what we used to call Columbus Day, is usually the peak foliage time. And this is really what people value about living in New England, is incredible colors of fall, and how relaxing and calming it is to take a walk along a wooded street or a little pathway at the Audubon Society's Broadmeadow Brook facility, or wherever you like to walk, even in beautiful Elm Park, and just kind of take a deep breath of that crisp fall air, and look at those beautiful colors, and you'll be feeling a lot better about everything. Even though, yes, winter is approaching, and winter has some drawbacks. We know this. A lot more hassles with transportation and cold and messy roads and snow, etc. But it's part of the whole package. And spring in New England, summer in New England, fall in New England, and if you're a winter sports person, winter in New England, we've got it all. So what we have noticed in the month of October as a kind of a society and as a medical community to try to emphasize, there's a lot of national events during this month, probably because school is back in session now and people are concentrating more on working now that people are back from their summer vacations, etc. So who do we recognize during this month? Well, this is National Dental Hygienist Month. And dental hygiene here in Worcester is a big concern of the Department of Public Health and all medical practitioners, because as you probably know, we are one of the only cities of our size in the country that does not have fluoride in the water. And I know this is a very controversial area. There were big battles fought, not literal battles, but legal battles, debates in the 90s that kept us from getting fluoridated. And almost any internal medicine practitioner or dental practitioner will tell you all they have to do is have you open your mouth and they can tell if you were a native Worcester person, because your dentition, your teeth, are in bad shape compared to others that live just in the next town. Shrewsbury has been fluoridated since 1953, and their oral health is much better than ours. So you may see over the course of this year, whether it's the Worcester Division of Public Health where I work, or the Worcester Board of Health where I report, or the Worcester District Medical Society, which is aligned with the Worcester District Dental Society, try to kind of raise this issue up again to see if now in 2023 we could potentially reverse the decisions of the 90s and get fluoride in our water. So this is National Dental Hygiene Month, and what you do in Worcester to counteract the effect of lack of fluoridation is you have to make sure you're using a fluoride toothpaste, and if you have a little kid, most of the Worcester Public Schools are covered by this. You can get fluoride washing approved so that your child's teeth are thoroughly inculcated with the good effects and protection of fluoride. Mass College of Pharmacy has a dental hygienist school, and they will also do this kind of fluoride washing on patients of all ages, actually. So I would check on your website for the Mass College of Pharmacy about their dental hygiene program. This is also National Physical Therapy Month. And for seniors like me, and for many of you out in the audience, physical therapists are amazing adjuncts to healthcare. If you have an injury, if you have a sudden strain from riding in a car too long or twisting a certain way, if you have unfortunately lost some bone mass and you're developing some curvature of the spine, or you have what's called spinal stenosis, all of these processes can be made better by the work of a good physical therapist. And I know this from personal experience. I've had bad back issues, I've had problems with my knees, and physical therapy folk have helped me each and every time. They individualize their course of action for you. Usually now they're very sophisticated. You know, they do a very extensive evaluation when you first come in, and then you get a printout of the exercises that they feel are, you know, best for you. We have a wonderful setup in the Worcester Senior Center of not only a physical therapy section, but then there's also a weight training section in the new gym that was just built in the last year. And it's really quite impressive. And so take advantage of it. If you're a senior center member, think about taking a visit in there and see what the trainers and the physical therapists can do for you. Other issues that have been brought up as campaigns for the month of October, it's National Lung Health Month and it's National Liver Health Month. So the two biggest bad boys of toxic ingestions, toxic activities that the United States citizens do are smoking and drinking alcohol. You know, there's a lot of emphasis on opioids, and surely they're a big problem here in Worcester and all over the country. But the basics of kids smoking early and getting hooked because of the amount of nicotine that's in those smoking products, and then the fact that we have probably a package store every 5 feet here in Massachusetts. We're one of the highest percentage states for alcoholism, unfortunately, in Massachusetts. Both very addictive activities. And it's important because if you drink too much, you can make your liver very, very unhealthy. The liver is a very, very important part of your body as far as metabolism goes. It processes all of the nutrients that you eat, because all of the nutrients that get absorbed go through the bloodstream and into the liver. The liver also produces bile, which is an important enzyme that will help to dissolve fatty foods. And if your liver starts getting attacked by alcohol and you start to get what's called cirrhosis, you lose the capabilities of eating and absorbing nutrition. And it's a kind of a downward spiral from there. So that's where liver health comes in. And lung health, you can imagine if you're doing lots of smoking, and that includes vaping. We have seen a whole new array of damaged lungs, which we call vape lungs, because people have the misconception that vaping is much better than just smoking on a cigarette. It might be a little bit neater because there's no ashes coming out. But the smoke that you're inhaling with the vaping can do a lot of damage. And it also has nicotine in it, which is the addictive part of things. So you may think that it's helping you avoid tobacco products, but it's probably keeping you on tobacco products. And, you know, the tobacco industry has been called out on this for over 60 years now. I'm a big World War II history buff, and I'm amazed when I'm watching one of these World War II movies that, you know, someone has turned me on to, and I never saw it. They were, one GI saying to the other, hey, you got a cancer stick I can have? So they knew, unfortunately, what the damage was when they pulled out a cigarette back in those days. So that was well before the Surgeon General's report in 1964 that linked cancer to smoking. And unfortunately, because of the way that the Army made their GIs have their mess kits, included in all the mess kits besides K rations were a pack of either Camels or Lucky Strikes or whatever the brand of cigarette was at that time, that got a lot of young men that volunteered in that terrible war in World War II to get hooked on cigarettes. So we've gotten much better as a society. The percent of people who are smoking has gone way down, but Central Massachusetts has a much higher smoking rate than the rest of the state. The rest of the state probably has a smoking rate of somewhere in the range of 17 to 20%. We're somewhere between 30 and 35%. So we have a lot of work to do. And at the Division of Public Health, we have tobacco cessation specialists that are trying to do a lot of work with the public on smoke cessation, but also trying to really make sure that the folks that are selling and distributing tobacco products are playing by the rules. That means nobody less than 21 years old should be getting any of these products. And on all of these flavored tobacco products, bubble gum and grape and all the other flavors you can imagine, aren't getting sold to minors, because that's the hook. That's what gets them into the whole process. And once they've gotten enough nicotine in them, they're stuck. Most of the kids nationally, when you question them, they make their decisions about smoking at usually around the 7th grade. So it's much younger than we think. And that's why also it's important as parents and grandparents to set a good example. And there's nothing more tragic than seeing, generations in a family, all smokers, all suffering from health consequences from that. So that's what Lung Health Month is about, is avoiding those kind of toxins to your own lungs. What else do we talk about during this month? This is also National Bullying Prevention Month. And I'm sure all of us knew somebody growing up in school that we would have called out as a bully. What most of my colleagues did, myself included, was try to avoid those people. But bullies are everywhere, and now what the children are experiencing is a new kind of bullying that's much more hurtful. It's called cyberbullying, because so many of the kids are on computers, on iPads, on Chromebooks, on cell phones. It's very easy to embarrass them, harass them electronically, a lot less physical, like the old days when people would challenge each other in the schoolyard. And it's hurtful because once something goes out, it can really propagate in all different directions and go viral. And that's a very dark place for the person who's getting bullied, and is one of the common themes that we see in suicide, that some event happens in school, person gets teased about it, and then they get very, very dark when they come home. They feel like their life is ruined. They can't take it all back. So this is something that is addressed now more and more in schools, and we're starting to realize that you can't just make the bully and the bullier I'm saying the bully and the bullied person just shake hands and make up. That doesn't work. You have to have people around the bully and the bullied person be what we call upstanders, not bystanders. Upstanders meaning they're going to call the person out who's doing the bullying. Hey, what are you doing? Why are you bothering this person? And that's what a lot of the bullying curricula teaches us, is that you shouldn't allow people to walk all over another person. You can't just be a silent bystander. That's true for not just school age. I would say that's true for the workplace. There's a lot of workplace bullying that goes on. It should be pointed out for what it is. And if you have a good enough supervisor at work, they'll know what to do. There's specialists in the human resources arm of most jobs that are trained to deal with this kind of situation. You know, as a parent and now as a grandparent, I dread a lot of this because I saw some of the consequences of kids that did the self-harm in order to get out of a world where they felt that they were, you know, being made fun of all the time. People can be cruel to each other. You hear the expression, "Oh, kids are so hard on each other." Kids, you know, humans are. I mean, just look at the Ukraine, right? You don't have to look very far to see examples of human cruelty to one another. So, bullying piece is very, very near and dear to my heart, and I think that sometimes it's a wise elder in the family that's the one that sees there's something wrong with their grandkid or their grandnephew that no one else has picked up on. Why are you so quiet? Why are you so, going in your room all the time alone? Why don't you want to play with your friends anymore? Ask the question. Sometimes it's, bullying. Sometimes it's drugs. Sometimes it's just, an awkward stage that the kids are going through. But I think a lot of grandparents have that radar that tells them, I got to figure out what's wrong with my grandkid because it's something's different. Something has changed. And the parent, especially if they have more than one kid and they're working a couple of jobs, they may not have the time or the radar that you've achieved over many years of your wise life. So, help us out with the bullying prevention. That would be really wonderful. This is also a month that is dedicated to people suffering from a disease called lupus. You might not have heard of lupus, but it's not that uncommon. It's an autoimmune kind of disease. So sometimes when you're listening to me on a show about who should get vaccinated, and I say people with immune-compromised disease are at risk, more risk for COVID, so they should get the vaccinations. One of the categories of immune compromise is lupus. Lupus is a disease where this your body is actually attacking its own tissue, and it can happen in any organ in the body, and it can cause some devastating effects. Most common are in the kidneys, but it also affects the gastrointestinal tract. It can affect the eyes, the lungs. It's not a great disease. There are a lot of good medications to help your immune system kind of slow down, but that makes you more susceptible to infection. So it's a complicated life that people with lupus live, and I've known several in my own life, and they're very heroic how they have to go through a lot of different changes in diet, changes in activities, and drug, steady drug use of these autoimmune disease drugs to really have some semblance of normalcy. So if you don't know anything about lupus, I would urge you just Google the National Lupus Association, and they have some very good information about it. So, I mean, that's, I think, the main list of month things. October 2nd is called Child Health Day, National Child Health Day. It basically just urges parents to make sure that their kids are, growing well, eating well. We have a problem all over the country. About 30% of the kids in the country, amazingly, are going to bed hungry. Maura Healey just passed a law that says that all school-aged kids are going to get free school lunch. And I think that's going to be a really good baseline, that we don't let the kids, suffer with low blood sugars and, the kind of gnawing feeling, if you've ever been hungry, that you can't concentrate on your learning. We also want the kids to get their vaccinations, and there's something in the order of now 26, 27 vaccinations over the course of their youth that they're supposed to get. And unfortunately, one of the consequences of the pandemic that we've been through is that there are a lot of people that are distrustful about vaccinations and the kind of recommendations that come out of the CDC and the Mass Department of Public Health and the Worcester Division of Public Health. We've seen overall, it's not just that the COVID vaccination has not been that popular. It's like all vaccination percentages have gone down. And that's why we've been seeing outbreaks of measles and outbreaks of polio, diseases that we had totally whipped. And now they're coming back because there's a group of parents that have become kind of anti-science when it comes to vaccine. So I would urge you, as the elder statesman in your family, if you're a senior watching this, to make sure that your family is following the recommendations of the pediatricians. The American Academy of Pediatrics is incredibly careful about the recommendations they come up with. And so that's my segue into what's going on right now health-wise in Worcester. As I'm filming this, this is still in the middle of September. And all indications are that we're in a little mini surge of COVID. The variant that's causing this surge is unclear. In different parts of the country, it seems to be different types of variants. They're all in the Omicron chain that came from the original COVID-19 bug that we all first were attacked by in 2020. After 2020, the next wave was Delta, and then the next wave was Omicron. And now we're seeing these mini outbreaks of these Omicron offspring that have very different kind of spike proteins on them. You remember we used to show a picture of a blue ball. That was the main part of the COVID virus, but it had these red spikes coming out of it. And the vaccines that were developed to attack and change the way that the COVID virus could create the spike protein. And now the spike protein is so different that the worry has always been that the vaccinations that we got are not going to be as effective against the newer variants that are coming out. But the good news is that I think between all of the people who have had the COVID infection itself, and some have had it more than once, and then all of the people that have gotten vaccinated, and we think around the country that number is somewhere around 70% of the population. There's a lot of immunity now to whatever comes down the pike. We seem to be fighting this off pretty well. We're not, even though the numbers of cases are going up, we're not seeing the hospitals flooded like they were back in 2020. You remember those horrible days where people had to wear garbage bags because we didn't have enough PPE for all the people, and unfortunately the bodies in New York City and in Rome and across the world were like stacked up outside the hospital because there was no room in the morgues anymore. No, we're not seeing that. We're not seeing those kind of things. But where there's more cases, eventually you see the cases go up first, then you see the ICU cases go up, and then you see deaths go up. So we're hoping that what's happening now is an indication of how much immunity the community has already, and that we won't have to do anything more than just make sure that people who are sick don't go to school and don't go to work, and get a test. The tests that we had, those rapid tests for home with the little swab in the nose, are still very good, even for these newer variants. And so if you suspect that you've got just a cold, or maybe you used to get allergies in the fall with the leaves falling and stuff, don't assume that. You could have COVID. It could be a mild case and you don't feel that bad. The key thing is that if you go unmasked and spread it around work, you're going to see coworkers going out or little kids going out. And that's what we're trying to avoid. So at UMass and at St. Vincent's, in clinical areas now, we had gone away from the masks for about 6 months. Now the masks are back on. In non-clinical areas, many people are not masked, but we also want to recognize we want to be a very mask-friendly community. We want people to feel comfortable wearing masks. Don't ask questions like, why are you wearing a mask? Indoors or outdoors? Clearly, indoors is a more confined situation where the virus, if it's in the air, if the circulation of the air is not that good, it's a much more serious situation where spread can be worse. Outdoors, less likely that you're going to be able to get the virus that way. But still, the numbers in late summer and early fall now have been going up. And the thought is now with schools back in session and some of the family gatherings that happen either for watching Patriots games or having some kind of fall festival, going to football games, there's more communal exposure, and there might be further surges going on. Even as I'm recording this, I'm hoping I'm wrong. I'm hoping that we're not going to see much increase. But the wastewater, we test the wastewater for evidence of COVID, and it has been going up very gradually, but it has been going up. So we know it's out there in the community. We also know that people aren't testing as much, so it's probably more prevalent in the community than we thought. But still, it's not knocking us out. And the reality is that COVID is going to be with us now. It's going to be like the flu. It's going to be like other viruses that we experience. And I think that we're going to have to learn to live with this. That being said, the scientists, the brilliant virologists and vaccine manufacturers have a plan, just like we do with the flu, that every year they're going to come out with a booster that will be addressing what they feel will be the most likely variant that COVID has to offer. And so, just as I'm sitting here, the FDA has approved a COVID vaccination by Moderna, the company, and it's designed specifically for a line of the Omicron's family of COVID, and it's being recommended, well, its use is going to be recommended by the CDC. The CDC, as I'm filming this, has not come out with their final recommendations. But I can tell you it's going to almost certainly include the high-risk groups, which we mean the elderly, people with lung disease, people with heart disease, people with obesity, people that are immune compromised, like the folks I mentioned before with lupus or HIV. That's the high-risk group in every surge. And I think that's the group that's going to have that recommendation to get this new COVID vaccination. It can be given at the same time as your flu shot, so you can kill two birds with one stone. And if you remember last year, we suffered through a period from late November until mid-January called the tridemic, where we had flu on the rise, COVID on the rise, and then RSV, respiratory syncytial virus. RSV typically was a virus that attacked children. Now, when we were masked up for 2 winters, we had very little flu and we had very little RSV. But last winter, we unmasked and suddenly the kids were exposed to RSV to the degree that their number of kids that were sitting in emergency rooms on oxygen waiting for beds just overwhelmed the system, not just here in central Massachusetts, but all over the Northeast. And we were sending kids far away because we didn't have enough beds in the city. So the good news is there is an RSV vaccine for adults that is available. And the current recommendation from the CDC is that high-risk individuals or seniors that are spending a lot of time with babies, I'm talking, less than a year, should get this, because that will lower the likelihood that the kids get this. Adults get RSV, but it's not very common and it's not very severe. But when a kid gets RSV, it can be real trouble. The kids are going to be offered a monoclonal antibody injection, but it's only a certain population of kids. It's a kid that's less than 8 months old who is facing their first fall and winter. So you have to kind of figure that out. I have 2 grandkids. I have a 9-month-old grandkid who's not eligible, and I have a 3-month-old who is eligible for the monoclonal. And I would definitely, I'm advised them to get it if they can. And I think that if you have kids in your life that fit those criteria, they should get this. It's not quite available as I'm filming this in September, but by this time that this comes out in October, I think it will have been approved and distributed. So that's kind of the triple threat of vaccinations that everyone is being recommended in the senior group. Get the RSV one first, and then get this booster for COVID at the same time as you get the flu shot. So you have 2 sessions, 3 shots. Don't be mad at me. I think it's the safest thing to do. And then you'll sail through the fall, and we'll get into winter, and before you know it, it'll be beautiful spring again. But here we are, still in the fall, and let's make the most of it. Apple pies and delicious apple picking going on in a lot of places. Nice brisk walks, watching the leaves, be a leaf peeper. So many beautiful places in and around Worcester. We do a program called Walk with the Doc with a lot of the members of the Senior Center in Elm Park, and we've been out there outside in Elm Park for the last 4 months. Prior to that, we were indoors in St. Vincent's, and I'm hoping that we can hold out a little bit longer and do the October walk and the November walk and maybe even the December walk in Elm Park, just so that we can enjoy the change of seasons by looking at that beautiful park. Designed by Frederick Olmsted, the same person who did Central Park in New York City. Just a very, very early attempt on his part to give us a magnificent space in the middle of our city, which at the time that he did design Elm Park, Worcester was one of the major Northeast metropolises, you know, and it's going to be that again. You will see. We're in a Renaissance period here in Worcester, and I'm very excited to be here during this time. So that's really all I was going to talk about today. I think that we've covered all the major high points of what is celebrated in this month. I do want to take my hat off to two other things. This is the month of October is Italian American Heritage Month. You know, there's been a lot of controversy about Christopher Columbus, and you know, he always had a day celebrating his quote-unquote, you know, discovery of America. It became pretty obvious based on how he treated the indigenous people that he encountered, that he either killed them or got them sick. And it's unfortunate because Italian Americans embraced him as one of their early heroes. He was from Genoa, and that doesn't take anything away from all the contributions that Italian Americans have done for the country and for Worcester in particular. So I want to acknowledge them. It's also Polish American Heritage Month, and the folks from that part of Europe with Polish ancestry were some of the hardest working and most industrious folks that came in the waves of immigration in the 1860s and 70s, and they populated a lot of the factories here in Worcester, and there are still big communities of Polish folks here in Worcester. All you have to do is head down to Golimo's on a holiday week where they're making their special holiday kielbasa and holiday bakery goods, and you know how many Polish people are in the town. So we want to celebrate them as well, and it's a wonderful melting pot that Worcester was and is. Now we have a different wave of immigrants coming in, as you know, from West Africa and Haiti and Afghanistan, Bhutan. Over 86 languages are spoken in Worcester, and that's what makes us, I think, really on the verge of greatness again, is that we are a safe haven for all of this new influx of wonderful and different and hardworking people that want to contribute to life here. So I take my hat off to those folks and wish you all a very nice month of October, and hope you'll be back with us in November when we start talking about Turkey Day, my favorite holiday. So thanks a lot. Keep on watching. Stay connected with the Worcester Senior Center. And this is Dr. Michael Hirsch signing off.